everyone, my name is Annalise Roque and I'm the Chief of Infectious Diseases at Emory University Hospital Midtown in Atlanta, Georgia. I want to start by acknowledging that March 10th is National Women and Girls HIV/AIDS Awareness Day. Over the past decades, HIV prevention and treatment has transformed lives. We now have highly effective antiretroviral therapy, extremely effective medicines that can prevent HIV, and people with HIV who are virally suppressed can live long, healthy lives and cannot transmit the virus. Yet persistent disparities remain. Women and girls, particularly Latinas, continue to face higher risks due to structural barriers like limited access to care, language gaps, stigma, immigration concerns, and socioeconomic inequities. Too often, prevention tools and treatment advances don't reach the communities that need them most. That's why culturally responsive care matters. Trust, representation, and access are not optional, they are essential. When women see themselves reflected in their providers, receive care in their language, and feel respected and heard, outcomes improve. Ending HIV means centering women and girls and meeting communities where they are. To better understand the human side of this work, we want to share a lived experience.
Hi, my name is Carla Quesada Torres, a mother, a wife, a daughter, a sister, tu hermana, tu comadre. I'm a community ally that has been working in these spaces for more than 25 years. And in this journey of 25 years, people have entrusted me, women especially, girls have entrusted me with their stories and the pain that HIV can bring because of stigma, shame, and silence. I have also seen the profound healing and transformation from these women and girls when we are supported, when we are informed, and when we are empowered. I have also been impacted by HIV, having to advocate for myself in spaces that providers and healthcare systems don't see me as a risk person. This is more of a reason why I invite all of you to celebrate, commemorate, but most importantly, take action. Celebrate National Women and Girls HIV/AIDS Awareness Day by taking power into that exam room, by asking to be tested for HIV, asking about your PrEP options. We're in a new era of PrEP options where oral and injectables are at our reach. Advocating for our health, including our sexual health, is an act of strength and resiliency, and most importantly, self-love. To my providers, my clinical teams, my clinicians, anyone that works in a healthcare system or an organization, please normalize HIV testing. Initiate the conversation and create a safe space for us to say yes to an HIV test. And most importantly, create a safe space for us to understand our PrEP options, our treatment options, and listen without judgment. Remove your personal biases. Partner with us women in our care, in our sexual well-being. Your leadership can change our outcomes, and together we can end the HIV epidemic. Stigma loses power when we speak. Stories create connection. Therefore, I invite all of you, women, girls, stay informed, get educated, get empowered, get the support that you need. Providers, lead with kindness and empathy, but most importantly, lead these conversations without judgment. Take action today and join our efforts. Celebrate and commemorate how far we've come, but most importantly, celebrate the next steps you're going to take to make sure that we as women and girls have an HIV test, have the PrEP options that we need, have the connections that we need to feel comfortable and empowered for our own sexual health. Thank you.
Hi everyone, my name is Lorena Bonet Velasquez, and I'm the Health Justice Policy Associate at the National Partnership of Women and Families, where I support efforts to advance policies and practices that improve the lives of women and families. On this year's observance of National Women and Girls HIV/AIDS Awareness Day and every day, advocacy is so crucial to addressing the barriers women and girls face when accessing HIV treatment and prevention tools, particularly Black women who are disproportionately impacted by HIV. Increasing HIV awareness and access to prevention tools like PrEP and testing require advancing equitable policy solutions that center the voices of women and girls, that combat gendered stigma and that eliminate the gaps in health coverage. This means protecting Medicaid, which is the largest source of health coverage for those living with HIV, and protecting Medicaid use in Planned Parenthood centers, which plays such a critical role for women and girls' access to HIV testing, treatment, and education. When we invest in women and girls, we strengthen entire communities.
Women and girls have powerful tools to prevent and manage HIV, and knowing about them is an act of empowerment. PrEP is a highly effective option that allows women to protect themselves from HIV. Routine HIV testing remains essential. It opens the door to prevention, early diagnosis, and timely care. For those living with HIV, treatment is life-saving, allowing people to live long, healthy lives. And when treatment leads to an undetectable viral load, HIV cannot be transmitted. This is U equals U, or undetectable equals untransmissible. Early testing and consistent care matter because they prevent complications, protect partners, and support overall health. This is especially important in maternal health, where early care can virtually eliminate perinatal transmission, and for youth and young women who deserve age-appropriate, stigma-free information and services. At the core, this is about empowerment. Women deserve accurate information. They deserve autonomy over their bodies, and they deserve the support needed to make informed choices for themselves and their families. Advocacy plays a critical role in ensuring women and girls can access these tools.